Welcome. We are going to introduce you to a device that has been used to successfully treat thousands of patients from all over the world for over 7 years now. This technological advancement allows a therapist to treat your spine more effectively and get better and faster results, with treatments performed on a specially designed, state-of-the-art treatment table. We believe the treatment with the technology-assisted mobilization and reflex stimulation device delivers superior results. But before we begin, it will be helpful to understand the anatomy of the spine and its 33 specialized bones, the vertebrae, as well as the joints between each pair. The spine is divided into the cervical, thoracic, lumbar, sacrum and coccyx. Between each are discs and joints that provide for mobility and flexibility. The spine has natural curves that facilitate function and has supporting and stabilizing muscles and ligaments. A healthy spine should be supple and elastic like the spine of a healthy teenager, but with time the spine naturally stiffens with injury, sudden movements or years of strenuous activity, and this results in the loss of spinal flexibility and mobility. Whether you are injured, have chronic back pain, can no longer participate in sports, or simply have difficulty with daily activities, we are dedicated to the challenge of helping you get your life back. 80% of people will suffer from back pain at some point in their lives, and many will have disc problems. Back problems are the most common cause of job-related disability and a leading contributor to missed work. Pain or disc problems are usually due to back injuries such as a motor vehicle accident or a fall, sudden minor movements, or years of strenuous activity, poor posture and poor fitness. A smaller percentage follows other medical conditions such as arthritis, osteoporosis, joint and disc abnormalities or degenerative processes. Regardless of the cause, most back pain sufferers seek medical attention. Conservative treatments such as rest, ice and pain relievers are often recommended. Patients with pain for more than 3 to 4 weeks are often referred for chiropractic, physiotherapy, pain management and surgical consultations, often with little or no relief. But with the assistance of our TAMARS device, our therapists can achieve effective and long-lasting relief for our patients. The device consists of a handset with 4 moving pads, which move in an alternating fashion with different settings. The device has built-in safety features that prevent the pads from applying too much pressure, and if resistance is met, the treatment pressure will be reduced. At first, the joint may be stiffened or fixed, but with treatment, mobility is restored. Treatments are performed with patients lying on a specially designed treatment table providing gentle, passive traction. The therapist will ask you to remove clothing on your upper body and loosen or unfasten undergarments. In order to make the treatment more comfortable, the therapist will use a small amount of hypoallergenic gel over the treatment area. Because each back is unique, your therapist starts every treatment by examining and assessing your entire spine. Treatment with the handset begins at the base of your spine. The device has 3 different modes of operation, and the therapist will adjust and alternate all 3 depending on how your back responds to the treatment. The first mode is the spasm mode, which prepares the back and helps to relieve muscle spasm. This lasts for 15 seconds and is used at the beginning and end of the session. The second mode is the reflex mode, which provides short taps to the paraspinal muscles to stimulate and wake up diminished spinal muscle reflexes to help stabilize and support the spine, improve posture, spine and back health. The third mode is the mobilizing mode, where the therapist moves the joints through their natural, normal and intended range of motion to restore back and spine function. Treatments are generally performed with a 5 to 7 day gap between sessions in the beginning, with the gap increasing as your back improves. Most patients require 4 to 6 sessions and return for maintenance treatment several times a year to retain flexibility and optimal spinal health. Following your treatment, it is important that you get up slowly as you may feel a bit lightheaded following the treatment. Do not twist or bend immediately following a treatment to allow your spine and back to get accustomed to the new and healthy posture and position. Your therapist will then be able to point out improvements in your posture and begin to demonstrate standing and walking tall exercises.